Hello, I'm Dr. Larry. Good afternoon. Today I'm going to speak on male health problems. Basically, what most men are afflicted with. Some people call it erectile dysfunction. Some people call it. Some have premature ejaculation. Some even have loss of libido, or whatever the problem is. I'd like to first start off by saying that most men have the capabilities of having sex well into the late 80s, even 90s. And sometimes it becomes a psychological thing. But in today's society and population, we see a lot of men between the ages of 45 and 70 having a lot of libido and sexual problems of getting erection. And we start to wonder why this happens. There are many clinics out there, health clinics and medical clinics, that look at this as a medical problem. And of course, the normal therapy would be, if it's not a psychological therapy, it's Viagra, Cialis, and Levitra. And this is what they use in the beginning. And then after a while, when that stops working or when there's too many side effects, then people seem to start going to HRT, what they call hormone replacement therapy. And this is a combination of, they find after they do blood work, they find that they need testosterone along with estrogen blockers and things of that sort. So that's another mode of therapy that goes on. And then after, sometimes that is very successful, and when sometimes that doesn't work at all, then now they go to the third, and this is where people are getting what they call the PRP shots, or they're also not just having the PRP shot, they're having what they call a Priapus shot, and that's where you take a certain chemical and you take a syringe and inject it into the penis, and within 5 minutes or whatever it takes, the man gets an erection for an hour and a half. Now usually that type of thing works. Some people do have allergic reactions to it, and remember, you can't do it usually more than twice a week. So if you're thinking of having a very sexual active life, no more than 2 a week. So now I'm proposing to you to show you a alternative therapy, which is a combination of laser therapy and also pulsed electromagnetic frequency. And when looking at the sexual organs, really what we want to really deal with, number one, is the prostate. In my opinion, I feel the prostate is the most important part. Now, many of you are thinking, well, I had my prostate checked and the doctor says it's okay. Yes, it may be okay as far as the PSA and the clinical test coming up negative, but that doesn't mean that your prostate is not slightly enlarged or that your prostate's functioning at 100%. And what happens is the prostate secretes seminal vesicle fluids, and causes that pressure behind that erection. So again, look at the prostate as a muscle. And if that muscle is not strengthened, then the erection won't be as good. Okay. The other thing is that we have in the organs itself, there are certain blood flow problems. There are tests done for blood flow. They use certain types of arterial Dopplers to test blood flow. Also, this type of problem, what we find is that the man has a psychological problem, thinking since it's been so long that he can't get it up, he can't. So that's another barrier that you have to overcome. But what we look at here, organically or naturally, is the vascular system. And of course, everybody's trying to bring more blood flow to the testicles, to the penis, and this is the main problem. Some people use natural methods where they use nitric acid, drinks or pills to help bring it up, and that does help. But there's also certain what we call electromagnetic frequencies or laser frequencies that can be done to stimulate the actual reproductive organs and to clear out the blocked energy. Because what happens a lot of times when the frequencies are not getting through at 100%, it's almost like you have a battery lighting up a light bulb, but yet the battery is only a quarter charged. It's not going to give as bright a bulb as something that was 100% charged. Well, what we tried to do here is remove the blocks, remove the frequency, the energy blocks, and put in positive frequencies to start causing stimulation of those organs and getting those organs to resonate at a proper frequency. Because you must remember, we're all on electromagnetic frequency. We all have our whole body is based on frequencies, and so if we clear out the blocks, increase lymphatic system, and increase blood flow in a natural way, we will get somewhat of a positive effect. It's each and different for each person again. Sometimes they've had research where they've done this thing called a new machine called an epoch machine. We had this epoch machine. It pounds against underneath your testicles, and actually causes microcapillary contusions. It increases blood flow. Sometimes to help break down adhesions. Sometimes something like that is successful as well. But we try to be something natural. We try to also do nutritional intervention where we're very specific on the bioenergetic nutrients that we give you to help make your health system strong. So, you may have some more questions. You feel free to email me at drlarrydirect@gmail.com. That's drlarrydirect@gmail.com. These are some ideas I gave you, some thoughts. I'm sure some of you have gone on other routes, but what we offer here is a holistic, natural approach to normalizing body function, to letting the body resonate at a proper frequency, and for the body to become healthy once more. Thank you and have a great day.